you kind of had two major changes happening on top of each other. One was a massive R platform migration that had been in the works for many years. This is a state-run hospital, so it had to work all the way up to the governor and many, many layers of approvals. And so that finally got underway after, several years of planning. And then right on the heels of that, there was an acquisition of a smaller hospital system in the Birmingham area as well that enlarged their footprint. And that system also is going through the same EHR migration. And we were already going to be helping with the integration of those two systems on just a basic technical level, getting everybody on the same sort of device hardware setup. And then the second phase is now transferring both systems, both hospital systems, from Cerner to Epic, which is the new medical records platform, and touches pretty much every single clinical space, every device, anything that is done for doctors and nurses. All of that depends on the EMR system on the back end. And so we got pulled in for what would normally be a pretty limited in scope and narrowly focused project. It was just a hardware implementation, where this is a little more complicated because that happened, but then there is a software component where all of the hardware also has to run this new EMR system. And so now phase 2 is going on, and that will continue. In fact, go live is this month for the smaller hospital system. That's kind of the pilot. And then the larger parent system that acquired the smaller one, their go live is next February. So instead of just 20,000 clinical end users, we're now supporting additional 5,000 clinical end users in probably, 5 hospitals and 20 clinics in the Birmingham metro area. So this team is now traveling not just in the kind of downtown area, but up to an hour all around Birmingham and some of the outlying areas that were part of this acquisition. So the complexity is both the work and the scale of it, and then also the commuting. And we were pulled in to kind of help build this all from scratch. And this was not like kind of laid out way we usually work, where you use a job description and a very specific type of skill set and background, where this is like, no, we just need people that can show up and do the work and be reliable and be kind of self-directed, because there's so much going on. No one's going to have a whole lot of oversight of them. It's gone really well. It's been, over a year now. The team that started as 6 technicians went to 12 and then went to 18. And then a month or two ago went to 24. And we may up it again after this go live, depending on the work that happens. So we could have 30 plus contractors all working across all of these different locations and commuting every which way in the meantime to do this work in a different space, every week. They didn't know what they were working with in terms of the acquisition. And so a lot of times these spaces, no one had been there. No one knew what the hardware setup was, what the supports role, like the hospital system that was acquired, they had outsourced most of that. So there wasn't any sort of on-site staff running this so they could be integrated into the organization. So now UAB had a large established desktop team, and we've worked with their IT system for the organization for many years, but it was always pretty self-contained. And this required a lot of conversations, ongoing conversations. Every week, for the last year and a half, I've been in conversation with the various levels from kind of CISO, IT director, and like the desktop teams, the managers, the leads. There's various layers. Because there's probably 100 people involved with this migration this month. That's pushing the go live in a week or two, and it's very much an all hands on deck situation. So it's kind of evolved over time too. Because when we started, we weren't really sure how many or how long, and it's just kind of grown and grown and grown. It's very much been a snowball, but it's been a good experience for all parties. We've had very low attrition. Despite how many cooks are in the kitchen, everything is getting done. We've kind of worked through all the kinks, and we've got really good communication, especially with the principal parties, basically me as kind of the representative for Seneca and the unofficial kind of program manager for all these different contractors, working directly with their IT team and the managers on that side. And then you've got various finance teams, 3 of them, to kind of make sure everyone's getting paid and the invoices are flowing the right way. And that piece of it is extremely complicated. Then we've customized our our timekeeping system to make it easier for this team to allocate their time to these two different hospital systems and these different projects. And so there's been a lot of adaptation on the Seneca side to make this work. And our client really appreciates that because we have been so flexible and basically kind of working with them to get this all done and whatever way that we can. Normally, when Seneca gets pulled in, it's for a person doing a very specific role, usually with a very specific set of skills and background and all that kind of stuff. And we just go I work with all the recruiters, so they find the right people that kind of check all those boxes. Whereas in this case, there were no boxes. I mean, other than that, you can show up, figure it out, whatever it becomes, and then kind of keep it moving. And the fact that this is fully on site with local talent, this is a lot of entry level talents and people kind of on the beginning or the end of their careers, and working in a very much a large self-directed team. So the inner dynamics of that are very important too. With this many people working right on top of each other, I mean, face to face with their end clients and these clinical spaces where you've got a lot of doctors and nurses. They're often very stressed out due to their own work. So the soft skills, the conflicts resolution, relationship management, all that kind of stuff has to be judged on the front end, in addition to the IT aptitude and making sure that whoever we put in can immediately hit the ground running. On the back end, like, this is a long project, so we got to get people that can kind of stay the course. And if they take another job or something else, we got to immediately be able to get somebody else in to kind of pick it up right where they left off, so that there's not a lot of lag or delays for large hospital systems just because of the scale of what they offer. It's a very well organized and tightly run ship. You do it their way or you don't do it at all. And so there's the adaptation that any particular client hospital system may have because of the specifics of their situation. We got to negotiate all that too. So it's both with the teams of these companies, finance, recruiting, all the rest of it, but then it's also with the other vendors. So you've got big consulting firms. They were involved on the front end planning of this, like Deloitte was pulled in to kind of help with the planning. And then Epic is involved all on the way up into implementation and beyond. And then we've also got to train their existing workforce, not just these hardware techs, but all of the, because I work with the data warehouse teams and various other IT teams too, and they all have to learn Epic. And a lot of these guys have been there for decades, and this is brand new to them. And so everybody has to kind of evolve with this project at various levels. Even if you're just a clinical end user, suddenly you have to learn a new system, and it requires a lot of grace.